Hello, and welcome to our Facebook Live about coronavirus. I'm Elizabeth Van Camp. I'm a member of the UI Healthcare social media team, and we're joined by University of Iowa Hospitals and Clinics Chief Medical Officer, Dr. Teresa Brennan. Thank you for joining us.
Oh, you bet. Happy to be here.
The 2019 novel coronavirus, also known as COVID-19, has been a concern in recent weeks, including here in Iowa. During today's broadcast, we'll start with some of the most common questions about coronavirus. Please feel free to submit your questions in the comments below, and we'll get to as many as possible. Before we start, this video is for informational purposes only. If you have questions or concerns about your health, please contact your primary care provider. Let's start with the basics, Dr. Brennan. What is COVID-19?
So COVID-19 is the name that's been given to this novel coronavirus that we've seen over the last few months. It was first identified in Wuhan, China. It is a coronavirus, and so coronaviruses come in many flavors. So sorry. Coronaviruses come in many flavors. About 4 of them actually just cause the common cold. There's a couple that we've known about for a few years. MERS and SARS are also coronaviruses. And then this new one is called COVID-19. It's a virus that causes symptoms very similar to influenza, and so it can be very difficult to differentiate. One of the differences from influenza, there's a few differences, but one of the differences is it seems to impact our older population and people with other medical conditions much more severely. The good news is that about 80% of people will have very mild symptoms, and so that's actually quite good news.
That is very good news.
Yep.
So our second question is, how does the virus spread?
So it's a respiratory virus, and we believe it's spread by droplets. So viruses can be spread in 2 ways. One is airborne, where it gets into the air and you breathe it in. This virus is not, we don't believe is spread that way. We believe it's spread by droplets. So when you cough, there's droplets in the air that you exhale, and it can get onto someone if they're within 3 feet, or it can go onto a surface. So maybe onto a table. People might touch that table, then touch their face, and then become infected, or eat from that hand.
Sure.
So that's why hand hygiene is so important. So as we do normal daily activities in hand hygiene, most of us don't think about how important it is to actually do it correctly. So when you wash your hands, really important that you do it for a period of time. So soap and water, you want to lather the soap for 20 seconds. So some people say that you can sing happy birthday twice, and that's about 20 seconds. And then rinse, and then dry, and then make sure you don't touch other surfaces after that, to keep your hands clean.
Sure.
The other part of it is in between times in between times of washing hands, it's important not to touch your face. And the part of your face that's really important is that T-zone where your eyes, your nose, and your mouth are. So touching your face can actually make you contaminate yourself and infect yourself.
Okay. And if someone doesn't have access to soap and water, hand sanitizer is a good alternative?
It is a good alternative.
Okay.
You want to use the hand sanitizer that has 60% alcohol. And you can use hand sanitizer pretty frequently. So keeping some with you,
Sure.
when you're out and about is a really good idea. A member of my family actually taught me to keep one in the car, which I thought was great because when you get in your car, you're in your car a lot. And then when you get home at the end of the night, you can use your hand sanitizer before you walk into your home.
That's a great
after
idea.
you've been out in the community.
Good idea. So what populations are most at risk for coronavirus?
Yeah, so everyone's at risk. It doesn't discriminate who gets infected. But the people that are at risk of bad outcomes, becoming critically ill or even dying, are those older people and people who have other medical conditions that might make their immune system not work as well. So those are the people that really should be more respectful of this virus and be certain that they're keeping themselves out of places where potentially they could become infected. If they would be in the grocery store, for example, and someone's coughing. Important to keep that 6-foot distance around that person. You don't have to run, you don't have to, create a scene, but just kind of purposefully and, compassionately, because that person's sick and we don't want to ostracize them.
Sure.
Right? But just try to get out of that 6-foot radius.
Okay. So how do we know how long someone can have the virus without showing symptoms?
Yeah, so there's a whole lot about this virus that we are continuing to learn every day. So we're not entirely certain, but we believe that you can be exposed to someone who has the virus or exposed to the virus on a surface. And within about 5 days, the average is about 5 days, someone who's going to be infected will actually show symptoms.
Okay.
That 5 days is very variable, though. It can be much less, or it can be out to 14 days or potentially even longer.
Okay. What is your best advice to people about how to protect themselves? We already covered hand washing and covering our coughs, but is there any other advice you give people, like avoiding crowded areas?
Yeah, so I guess the advice that I would give people is that you shouldn't panic and you shouldn't be fearful of this. It's a virus like many viruses that we've seen in the past. It's a new virus and it may have some more harmful effects on people, but panicking is probably not going to help. You do need to respect the virus. So the virus can cause people harm, and so respecting it and taking precautions. So hand hygiene, again, I'll say it again, very important. Mm-hmm. Lathering for 20 seconds. If soap and water isn't available, use the hand hygiene gel. Frequently. Mm-hmm. Try not to touch your face. Touching your eyes, your nose, your mouth, really important because that is potentially causing you to be infected. For those people that are at highest risk of having bad outcomes, you might want to consider where you're going. So going to a gathering with a lot of people may or may not be a good idea. Those are just choices that each of us as individuals probably should be making. And we know that we have cases in Johnson County. And so there is the potential that community spread will happen. And so, if you are at high risk, probably social distancing is what we call it, where you try to keep that distance of 6 feet and try to not have interactions that are unnecessary.
Great. So I'd love if you could talk to us a little bit about the symptoms and then what someone should do if they find that they are experiencing those symptoms.
Sure. So as I said, most commonly we see that people have mild symptoms. So about 80% of the population, it'll seem like a cold. They might have kind of respiratory symptoms, a cough, maybe a low-grade fever. Some people will have more influenza-like symptoms where it's much more severe and they just feel bad.
Yeah.
Certainly patients may have more advanced symptoms like having breathing troubles and needing to be cared for in a hospital. There are a small number of people who have GI symptoms, gastrointestinal symptoms like diarrhea as well.
Okay.
So very similar to influenza or even the common cold, which makes it really challenging to be able to differentiate when a patient might have COVID-19 because they've been exposed to someone with COVID-19, right, versus influenza or a common cold.
Yeah.
If you have these symptoms or if you're concerned, so if you're well and you're concerned, wow, could I have been exposed? I live in Johnson County. Could I have been exposed to someone, right? I'm worried. The Iowa Department of Public Health has a hotline, and we'll be glad to answer questions. And that number is, the easiest number is 211. So if you call them, if you're kind of the well and worried,
Sure.
that would be the right thing to do. If you have symptoms and you feel like you might have the virus, like I could have it, then we want you to call first. Unless it's an emergency. If you can't breathe or you're feeling like something bad is going to happen right this moment, then of course come to the emergency room.
Okay.
But otherwise we'd like you to call first and we can direct you to where you would best be treated.
That's very good to know. So we have a question from Tina. Are there any restrictions at the university right now that are new? And so this might be a good time to talk about our visitor restrictions.
Yes. So I feel like, Tina, that's a really good question. I feel like our most important job as healthcare providers is to take care of our patients, and in this situation to try to contain the virus and make sure that we're taking care of our staff, our faculty, the students that are with us, as well as the other patients in the hospital. And so one of the things that is done very commonly across the nation when there are infectious outbreaks, which COVID-19 is an outbreak, is to limit people gathering in spaces. And so we have elected to have a 2 adult policy for visitors in our hospital. Those 2 adults must be healthy. So we don't want someone who is sick coming in and potentially transmitting it to our faculty, staff, patients, visitors. And so this is actually something that is pretty common. And actually I'm told that is going on at other hospitals in Johnson County as well.
Okay. Is there anything else that we are doing to prepare for the virus here at the hospital?
Yes. So I feel really fortunate that I get to work with a great team. And over the many years, we have had a really excellent emergency management team here at the hospital to try to prepare us for any sort of emergency that would happen. One of the things that we have here is a bioemergency response team. We lovingly refer to it as BERT. And BERT has been meeting since January to try to identify if a patient needs to be in the hospital, how will we care for them? How will we take care of the other patients? Where would we direct patients who need to be seen in the ambulatory clinic? So some of the things that we're putting into effect actually right now in the next few days are we will be offering televideo appointments for patients. These would be patients that have some illness, they feel like they're ill, and they want to know, do I need to worry? And so they would do a video visit and determine whether the patient needs to be seen by someone or they could remain at home. One of the things the CDC has told us and that we saw in other areas where outbreaks have happened is containment is really important. And if you are ill, whether you have influenza or you have COVID-19, it's really important to try to limit your exposures to people. And so we want people to stay home if they are well enough to stay home. If you're not well enough to stay home, we're going to direct you to the right place, the right clinic, or even the emergency room if you're quite ill, to be cared for correctly. And I would say that whether you're in Johnson County and considering coming to University of Iowa hospitals and clinics or wherever you are, that is a very good plan. If you feel bad and you feel like you want to talk to a healthcare provider, call first and see if they can direct you to the right place rather than just showing up. You'll probably get faster care and the potential for you to spread whatever it is that you have actually goes down.
Okay, great. So you've already referenced steps that people can take to protect themselves. But what should people do if they already have plans where they're going to be in close quarters with others? Do you recommend that people, reevaluate those plans? Should we really keep that social distancing in mind for the next few weeks or months?
Yeah, I would say this goes back to the don't panic, but respect the virus. And so depending on where you are, if you're, I would imagine that someone seeing this might be, far away from us, right? In a place where there's not been any infections identified, that you might say, well, I think it's okay for me to go. And I'm young and healthy, and so maybe it's okay for me to go.
Sure.
But, if a patient has just undergone chemotherapy, that might be a patient that might stop and say, well, maybe the event isn't worth the potential exposure.
Sure.
So I would just recommend that people be thoughtful. And if you have medical conditions, maybe talk to your primary doctor about, should I be keeping distance from people? Should I be doing social distancing? Should I be out in the community? What is best for me individually? Because it's really an individual decision.
Okay, that's great to know. So if someone arrives here at our hospital or at one of our clinics and they thinking they have coronavirus, can you tell our audience a little bit about what that process looks like?
Sure. So the first thing we would do when you arrive would be to ask you to put a mask on, right? So there's no data that says that wearing a mask in the community, if you're well, protects you. But we clearly know that if someone has an infection that is droplet spread, like this virus, that putting a mask on actually prevents those droplets from going out and about.
Okay.
And so you'll be offered a mask. And of course we want to offer you a mask and be, kind and compassionate about that. But we really want you to put that mask on because it's important to prevent spread. And sometimes if you're affected or if you're ill like that and have influenza or even COVID-19, wearing a mask at home would not be a bad idea either. So you would come in, you would be evaluated by one of our practitioners. And if there's a reason to suspect COVID-19, presently the reason that we test for it really revolves around where you've been or who you've been exposed to. I suspect that testing actually will become more widespread as community transmission, meaning that it can be passed along in the community. It's not really travel related.
Sure.
As community transmission increases, we'll probably be testing more people.
Okay.
Right now, the practitioner would evaluate the patient, a nurse practitioner, a PA, a physician, and if we felt that COVID-19 testing was appropriate, then we would call the Iowa Department of Public Health and have a conversation about whether we should test or not test.
Okay.
That test takes a bit of time. So generally it's about 6 hours, but depending on the time of day, it may be the next day before the test result is back.
Okay.
If that patient is feeling well, let me rephrase that. If that patient is not feeling terrible or doesn't have a need for hospitalization, particularly no need for hospitalization, we actually will send that patient home. We may give them medications to help them feel better, or to, if we are worried that they have influenza, might give them a medication for influenza.
Okay.
But most patients would have an evaluation, there would be a discussion about testing, and then the patient would likely go home.
Okay. Great. So it's really easy to get overwhelmed by the information we have at our fingertips on the internet and on social media. Do you have any tips for people on where to find accurate information in terms of coronavirus?
Yeah, so you can't turn on the TV or pick up your phone today, right, without coronavirus being the top on the list. So the CDC has an excellent website. Going to the CDC to see, they have great tips on how to prevent yourself from being infected and where the virus is. The Iowa Department of Public Health as well has a very nice website, and if you're in Iowa and you're interested in knowing how many cases there have been in Iowa, that's the best site to go to. They also talk about who's been tested, not who specifically, but the numbers of people.
Okay.
And then finally, coronavirus.uiowa.edu, there's information for those here in Johnson County as well.
Great. We've got some questions coming in on Facebook, so I want to get to some of those. Chris asked if it's true or not that the COVID-19 can spread easier or faster than the flu, or if there's a difference in how it spreads.
Yeah, we believe, great question, Chris. So we believe that the level of contagiousness is higher in coronavirus, COVID-19, than it is in the flu. It may be up to 3 times more contagious, which means that a single individual can pass it on to more people. And then it also means that the transmission in the community may actually go up more rapidly. Sorry.
Great, thank you for answering that question. We have a few people asking about kids with other health issues. One mom says, my son has epilepsy. Another says their son has muscular dystrophy. And they want to know, 1, are they at higher risk for complications? And 2, should they keep them home from school? Do you have any guidance for parents on this kind of stuff?
Sure. So as a parent, I can understand why you worry about your children. We worry about them all the time, right? I have a couple that are older, and I still worry about them. We certainly want to do the best we can to take care of our kids. I can tell you that to date, what we know is that although children can become infected with COVID-19, that they tend to do very well. And the number of people who have more serious conditions increases with age. And to date, we're not seeing serious illness and death in young people. So I would follow the policies of the local public health department. If they feel like school should be canceled because there's a risk of great transmission, they will cancel schools. So again, I go back to the don't panic, but respect it. So what you can do for your child, though, is teach them how to wash their hands and not touch their face. I had a colleague just tell me that his son came home and said, Dad, I know how to wash my hands. You'd sing happy birthday twice as you're, rubbing the soap in, right?
That's so great.
So really good to teach them that, and that stays with them.
Yeah, great. So Julie wants to know if we know yet if you're immune from coronavirus after having it. Is that something we know yet?
I don't think we know. So I'm not an epidemiologist or an infectious disease doctor by training, but I think the virus is so new that we actually don't know if people can be reinfected.
Okay.
I believe that there's things on the internet saying that people have been.
Sure.
But again, I would go back to what we talked about earlier, that it's really important to get your information right from the area where we know that information is true and is verified. And so going to those websites as opposed to social media and other sites or media sites, yeah.
That's great advice. Someone wants to know, will there be, or do you anticipate there being changes to our volunteer program here at the hospital?
Yeah, that's a really good question. So we have a fantastic volunteer program, and they interact with our patients a lot. So we would right now say that from a volunteer standpoint, our volunteers should do the same things that we would say for our faculty and staff. If you're sick, meaning you have a fever and cough, sore throat, runny nose, you should stay home. We're not enacting anything differently from the perspective of segregating our volunteers or even not having them come to the hospital at this point.
Sure. Well, it looks like you have answered a lot of the questions that people are submitting, and you've answered all the questions I had. Is there anything else for our audience that you would like them to know about coronavirus, or you'd like them to take away from this video?
Absolutely. So again, I would go back to don't panic, don't be fearful, but respect the virus and don't become complacent. And the way to do that is washing your hands frequently. If you're ill, cover your mouth with a tissue when you cough or sneeze, and then dispose of that, and then wash your hands. If you don't have a tissue available, you can certainly cough into your bent arm, into your sleeve. Not so good to kind of turn your head into the air because, as I said, it's droplet. So wash your hands, don't touch your face if you can avoid it, and stay away from crowds if you're not well, if you're sick. The other thing I would say is wherever you are, if you become ill, call in, and the healthcare team will tell you where it's best that you get your care. The containment of these viruses is really important, and so we want to make sure we direct you to the right place.
Great.
And if you're well, 211 can be very helpful.
Great. Well, thank you so much for sharing your expertise with us today, Dr. Brennan. This is invaluable information for us.
Happy to be here. Thanks so much for having me.
Of course, and thank you for everyone who tuned in today. If you tuned in later during the broadcast, make sure to go back and watch the entire video so you can get all the great information Dr. Brennan provided us. And stay tuned to the UI Healthcare social media accounts and our website, uiht.org, for more updates about coronavirus. Have a great rest of your day, and please remember, wash your hands, avoid touching your face, and stay home if you have any of the symptoms we've talked about today. Thank you.